Hello and welcome to today's presentation on African American women and obesity in South Carolina. My name is Nicole Sherrard. I am a registered and licensed dietitian. I received my bachelor's degree and dietetic internship from the University of Prince Edward Island. This content of this work are for a project completed by a student in the University of New England's Master's Applied Nutrition program. All works published by students are solely the responsibility of the student author, and viewers, readers should be aware the work, statements made, and opinions expressed are strictly those of the authors and not the University of New England. This presentation was developed with the South Carolina Public Health Association in mind. Our outline today is overview of obesity, determinants and impacts of obesity, interventions, and conclusions. Data collected from the National Health and Nutrition Examination Survey from 2021 showed obesity in the United States affected 41.9% of the population, with non-Hispanic Black adults accounting for 50% and more than any other race. In 2019, the total annual cost of obesity and subsequent conditions such as heart disease and type 2 diabetes was $173 billion. There are many key determinants and impacts that affect obesity in African American women. Today we will be discussing 4, including geography, poverty, family commitments, and culture. African Americans are the third largest racial group in the United States, and approximately 90.4% who reside in southern states like South Carolina live in rural areas and make up 11.5% of this population. Rural African American residents are more likely than their white peers to live in a county without a hospital or home health agency, and 84% of counties they call home are considered health professional shortage areas. 75.3% of rural African Americans live in a county where the uninsured rate is 12.2% or more. This means getting access and coverage for adequate health care can be problematic. Those living in rural environments have a disproportionate burden of chronic disease relative to the general public. Mortality rates of the rural African American population are greater than both white rural residents and urban dwelling African Americans. Physical inactivity is more common in ethnic minorities compared to Caucasians. 60% of African American women living in the rural South live sedentary lifestyles. Females of all races have factors inhibiting exercise, such as lack of time and energy. However, research shows African American women are also more likely to be without a safe place to exercise. In rural areas, sidewalks, street lightings, and other environmental factors may not be conducive to exercising outside. Additionally, exercise and recreational facilities do not often exist in rural areas, and transportation may not be available. The U.S. unemployment rate returned to a historic low of 3.5% in December 2022. However, jobless rates for Black women still haven't recovered fully from the pandemic. Reasons for this we will discuss, including occupational segregation that crowds people of color into low-paying jobs and women caregiving responsibilities within families. In the United States, 32% of workers across the country earn less than $15 an hour. Women of color are disproportionately affected by this. Among women of color, half of workers make under $15 an hour. If you factor in raising a child, commuting to work, and a second job to make a living wage, there is no additional time in the day to exercise or plan healthy meals. Many of these women are part of a sandwich generation where they are supporting parents over 65, while at the same time raising a child under 18 or have grown children at home. African Americans are more likely to support parents financially compared to other races at 40%. Of single-parent homes, most are female. In South Carolina, 39% of children live in a single-parent home, which is on the upper end of statistics in the United States. Furthermore, 64% of African American children in the United States are likely to be in a single-parent home. African American women are not as concerned with their weight compared to Caucasians. One study found even though Black women had a higher body mass index than white women, they perceived their weight to be lower and attractiveness higher due to their preference for a curvier body type. Soul food is composed of fried foods, fatty meats, and rich gravies, which originate during the times of slavery when African Americans received what was left over from the slave owners taking most of the nutritional food for themselves. Although this diet contributes to obesity and health problems, recipes and eating styles are still passed through generations as traditions among the African Americans. African American rural residents lag behind white residents in educational attainment. About 20.7% of African American adults living in rural areas versus 10.4% of white adults have less than a high school diploma. Also, the number of women getting an associate or bachelor degree by the age of 29 nearly doubles that of Black women. It is not surprising looking at all of the data that we just did that 98.4% of low socioeconomic status Southern rural adults lack proper nutrition. There have been studies directed at the African American population to improve nutrition and obesity, with most success noted in church, as African Americans living in the South are more likely to go to church than those living anywhere else in America. Due to their density and outreach, places of worship can reach many individuals and populations that may otherwise be represented. The South Carolina Department of Health and Environmental Control promotes program Protect Your Body, Protect Your Temple, developed by the Office of Minority Health. Research has shown positive outcomes when healthy eating and exercise are incorporated into the church in forms of education, such as brochures or toolkits. The Supplemental Nutrition Assistance Program, also known as SNAP, has ED toolkits, and one titled Faithful Families, Thriving Communities uses the social ecological model to partner physical activity through a nutrition and physical activity trainer and a worship leader who together teach 9 courses in a program titled Eating Smart and Moving More. This program has predominantly been implemented and successful with low-income African American communities. Notable improvements include use of and understanding of nutrition facts to make food choices, planning meals ahead of time, shopping with a grocery list, and preparing food without the use of salt. Previous research has also shown family engagement and decreased stress levels with delivery of healthy, low-cost food kits to families. In conclusion, many variables at each level of the socio-ecological model impact an African American woman's weight status. Further research could focus on longitudinal data, as short-term studies have found successful interventions as previously reviewed. Also, further research on outreach in the communities, for example, looking at more details into the delivery of low-cost healthy meal boxes, such as specifically measuring nutritional status after consumption over a period of time, could also be beneficial. Thank you for watching.